welcome to the Mindful Learning podcast. I'm really delighted to have Bradley Riddell here talking to us about his journey to becoming a therapist, his experiences as being a therapist, and his sort of advice about what does make a happy life. And we will, to a certain extent, explore in, I think, quite a complex way what the kind of different genders might approach things by, in the world. And so I just want to hand over to Bradley, first of all, to talk a bit about, his journey into becoming a therapist. Maybe you could tell us a bit about that, and then we can go from there.
Yes, okay. Well, thank you, Francis, for the invite. It's a delight to be here. And yes, a little bit about me. I was born in Cape Town in South Africa many moons ago now, too many for me to contemplate. But my parents settled in the UK when I was 3 years of age, and I was educated here and raised here. But I always had the sense of another place from where we sort of originated, which was an interesting kind of backdrop. I actually got involved in therapy via a very circuitous route. I think, like many people, actually, it does seem as if this is one profession in which people tend to be attracted to it later in life, not exclusively, of course, but predominantly people going into psychotherapy and the therapeutic profession have got some miles on the clock. They've got some water under the bridge, and they tend to have lived, and that's the crucial observation. I think that it's in the experience of living, what would otherwise be called the experiential journey, to use the psychotherapeutic sort of terminology, which can sometimes be tedious and interminable in the psychological and psychotherapeutic field, and I think that's why a simplified approach can be terrific, and also just bears out the maxim that genius lies in simplicity. Anyone can say something with a million words, but to be concise and precise and convey the same sentiment is an art in itself. So my lived experience really underwent a number of, I guess you would call them, important events in my life. Moving around was a big, important factor in my personal life. My father was a vicar in the Church of England. He was from the wrong side of the tracks in Durban in South Africa. He grew up to a father who was a scale fitter and an alcoholic, and a mother who was reduced to bringing up her three kids on her own when my father's father died when he was 14. They were in South Africa back in the days when to be white was to be privileged, and to be black or coloured meant that you had a life of suffering de facto. And to be a poor white in South Africa in those days was the lowest of the low. So he grew up with his back against the wall. He managed to get himself out of that situation through his intellect and his sporting prowess. So that's what got him above and beyond, and moved to here. He found Christianity later in his life, although it was in his kind of late teens, really, when he became a Christian. He met my mother quite early on, joined the church, became ordained, and then moved to England, where he took a theological degree and became ordained over here, and then had a church in Bristol, St. John's on the Wall in Bristol. We then moved around with his career. So there was a lot of what, Bowlby and attachment theory would call, the loss of familiar places and faces. So there were ruptures in my life. But you kind of get on with it. You're a kid, you don't know any better. So I think that played a part in my kind of experience.
Yeah.
And I became rather too dependent on alcohol, largely through, well, not largely, but because of the influence, I think, of my father. My father was teetotal for 10 years. So up until I was about sort of 8 or 9, he was a teetotaler, and then he kind of went back on the booze gradually, and eventually developed quite a serious kind of problem, really, with alcohol. I myself was excluded from school when I was in the upper 6th. That was a big event in my life. I then had my very best friend, when I was 21, died, developed a tumor on the brain, which was inoperable. So chemotherapy was the only treatment possible. If they operated, it would have killed him. So he went from being a very outgoing, extrovert, lovable, friendly, entertaining guy, to an absolute shadow of his former self, where he just couldn't put sentences together. There was real neurological damage that had gone on. So I was 21, he was 20. So that was massive. That floored me for a long time. And I eventually ended up, because it completely pulled the rug out from under my feet, and all the certainties and certainly all the defenses I'd built up for myself in all the years of moving around, just disintegrated. And I started using booze to self-soothe, self-medicate. And it culminated in me actually leaving, buying a ticket on the Magic bus to go to Athens. I bought a rucksack and I got out because I was suffering panic attacks. I was working as an advertising executive in a trade and technical publishing company, and I was doing well. I was promoted to assistant ad manager, but I was really struggling. I'd have to leave the room when I would just start sweating profusely. And I'd sort of have to take myself to the toilet, the restroom, as the Yanks would tell us. And I'd have to go into a cubicle and strip naked because I was just pouring sweat. It was embarrassing. It was confusing. It was worrying. I sort of thought, what on earth is wrong with me? So I eventually, well, my youngest, well, that's another story in itself, but my second but one from the end, if you like, the second youngest brother, said to me, why don't you go off and find yourself, so to speak. So I bought a rucksack, got on the bus, the Magic bus. I don't know if you remember the Magic bus. Maybe some of your viewers or listeners will remember the Magic bus, but it was a cheap one-way ticket to Athens. And off I went, and that began a bit of an odyssey, which sort of lasted on and off until I was, in my early 30s, really, because I ended up going back to South Africa to stay for a while. I met my wife out there, or my wife-to-be, which led a lot of people, understandably, to sort of say, oh, is she South African? I said, no, she's from Croydon. She was traveling as well. We met out there, and we're still together now, all these years later. And I got into mini-cabbing, actually, because it was a fairly sort of transient type of job that you can sort of do and not do. And at the time I was doing it, which was in the 80s and 90s, that I was doing this mini-cabbing work. And there was money around, so it was, you could earn some good money. And there were no ties, and it was sort of self-employed. You could dip in, dip out. You could do well. So I was doing that for a while. And then we moved from London, where I was doing this, down to Brighton. And that was 24 years ago. And I've been down here since then. I carried on driving up to London for a while. And then I got a job with the local authority in integrated learning disability services as a support worker. So I was supporting service users as they had to be referred to. It was a very council kind of strict nomenclature, you know, you had to use the right terminologies and so on. And I saw an advert in the I can't remember what it's called now. It was a local paper that was just come out. There was an advert in there anyway for volunteer counsellors. Sorry?
The Evening Argus, that's what I remember in Brighton.
Oh, the Argus is down here. It was something else, and I can't remember what it was called. It was kind of a dedicated free sheet, which was full of adverts and things for sale and blah, blah, blah. And in there, I saw an advert for volunteer drug and alcohol counsellors for a charity ad action based in Brighton. And they were looking for volunteers to come for interview for free training that would, you know, allow them and qualify them to work with the service users there at the agency ad action for drug and alcohol issues. And at that time, I still had little idea of kind of where I was going and what I was going to do with myself. And it seemed to me to offer a career. And it seemed to be something I was, you know, aware of, drug and alcohol abuse. And, you know, but at that stage, I still was drinking and I still was taking recreational drugs, cannabis, weed, because I'd spent time out in Holland and had become really heavily interested in smoking and the, you know, sensation of I guess the altered consciousness. That's the big thing. So I went along. We had a 3-month in-house training, and when we qualified, we then took on clients. So the agreement was, we'll train you, but you'll give us 4 hours a week minimum for clients, and we'll give you free supervision. So that was the deal. So that's kind of how I started off. And I enjoyed the work. And there was an element of catharsis involved in it too, because I was kind of facing what I sort of knew was my over-reliance and overuse of alcohol. And the questions were beginning to form in me, but they hadn't fully formed. So I went down that road and I took a certificate and then an advanced certificate at Lewis College. And then I took a postgraduate diploma at Northbrook College in Worthing. And that was a 2.5-year course. And eventually qualified in 2014 because it took longer than expected. Tragically, my youngest brother became ill. He was at that time teaching on the international circuit. He qualified as a teacher, and my next brother up, the one who suggested I buy a ticket to go off to Athens on the Magic Bus, he was also a teacher. And so my youngest brother followed him on the international teaching circuit. And while he was away, he caught some kind of virus that got into his brain, and it killed him. And it was tragic. So that interrupted studies. So that sort of meant that things went on for longer than anticipated, and also threw up a lot of stuff as well for all of us. Not least my poor old mum. It is very much that thing that, you know, you should never, ever have to bury your own children. You know, that's a very, very traumatic and difficult thing to undergo. So that sort of elongated the training. But I qualified in 2014, and I've been in private practice since about 2017, 18. So I worked. I was still working as a support worker while I was doing my training at Worthing, and I managed to arrange the Wednesday as my day off, because it was one day for 2.5 years, attendance. So I was able to do that while I was still working. It was pretty tough. I remember I had a stint of 60 days, I think, without a day off, which is pretty tough.
Tough, yeah.
So fitting in the training along with the work to earn the money, along with the work experience, which I had to do as part of the qualification. So that was pretty tough, and it felt quite exploitative at times, I have to say. That we were working sort of for nothing. For a charitable organization that was being funded to deliver this service, and they had salaried members of staff, so it seemed like a little bit of an imbalance, but you can't bite the hand that feeds you. So so it was tough. So I got into private practice about 2017-18, and I've been doing it ever since. And behind me you can see the office where I practice. If I move my chair out of the way, you can see the old counselling chairs there at the back.
And the whiteboard, as it were.
The flip chart.
Flip chart. Maybe we could have a little chat about sort of addictions and your experience of dealing with clients. Obviously everything has to be anonymous, but maybe you can take us through maybe a one or two sort of typical case studies of the sorts of issues that present to you, and then maybe we can talk through what does actually work if it's not too simplistic to do that. Just any thoughts on that?
Yes, absolutely. At the very beginning, it's one size doesn't fit all. It's very much bespoke. One fits the therapy to the client, not the client to the therapy. And that does remain a problem within this field, because there is sort of what one would call schoolism. So you have the different schools of psychotherapeutic followers, and some of them will stick really rigidly to their paradigm and not deviate from it. I was trained in the integrative style, precisely because I didn't want to fall into that category. And I used to get very, very frustrated and sometimes quite angry at the pure person-centered approach. That was my bugbear. I know that when I was on the Human Givens training, where you and I met, I'm sure you don't mind me revealing that, or
no,
do you?
No, absolutely. No, it's a open thing. That I'm training to be a therapist. And we met on a therapy course. I mean, it's very interesting to talk about this, because I guess the person-centered, and again, Bradley, you can correct me if I'm wrong, it is more perhaps comes from the Carl Rogers school, very interesting, fascinating sort of therapeutic, where you are listening and reflecting back what the client wants, and as Rogers says, doesn't he, the sort of truth comes bubbling up, and you sort of build on that using positive regard and acknowledging what the client says. Maybe you just speak about what are some of the strengths and weaknesses of that, because it's certainly something Human Givens sort of encourages us to use, a kind of reflective listening, which is basically you're listening really carefully to someone and sort of almost saying their words back at them or summarizing them, just to get a sense so they feel heard, and that's really vital, isn't it? But any thoughts on that?
Oh, absolutely. It's incredibly important. The bugbear I have with it is that my contention, and other people would agree with this, others wouldn't, but my contention is very much that it's impossible to be a therapist without being person-centered. If you don't respect the sanctity of the person sitting in the chair in the room with you, and if you don't regard other human beings as being valuable, important, and self-determining, then you've no business being in the therapist chair. So what I'm sort of almost,
but I guess what's interesting, isn't it, that you know, a classic Freudian, and Human Givens does a good summary of this, would actually be coming with a prescribed sort of set of ideas. So, for example, you know, that understanding someone through the Oedipus complex, that they will then impose upon the client. So the Rogers approach is very different from a classic sort of psychoanalytic Freudian approach. It's just thought I'd, you know, throw that in. You know, yeah.
Yeah, no, absolutely. You're quite right. And this is where schoolism comes in.
Yeah.
So there are different schools of psychotherapeutic interpretation. The bottom line, however, is that there are human beings in a room. One of them is seeking help, and one of them is offering help to the person seeking help. So the person seeking help would have an idea about the paradigm of the person they're seeking help from, although not in all cases. So it remains, I kind of call this the Peter Cook and Dudley Moore syndrome, really, which applies right across the board, because it is not only, but also. I mean, it's not only am I a psychoanalyst, but I'm also a human being. Not only am I a person-centered therapist, but I'm also a human being. Not only are you struggling and looking for help, but you're also very good at helping yourself in times when you don't feel distressed. And so it's really throwing into relief. And this is very much a Human Givens stated position, you know, using their APET and their RIGAR model, you know, where you do gather information, where you do build rapport. And even there, right at the beginning, the rapport building is very much one of Petrushka Clarkson's 5 relationships, the person-to-person relationship. So, you know, Petrushka Clarkson was a Gestalt therapist. So she's not person-centered in her primary orientation. But again, this is where I would argue that the primary orientation is almost like saying I was born or birthed into psychotherapy via this kind of birth canal. This is how I came into psychotherapy. Once I'm now in the world of psychotherapy, my original orientation may be my line of descent back to my country of origin, such as it were, my school of origin, such as it is. But it's impossible to hold to that. Because again, you have to fit the therapy to the person. So what if you get a client in the room who is looking for direction and advice and wants to be told what to do? Where does the person-centered paradigm allow space for that? Because then you would have to be directive.
Because the Freudian one would be, you know, you're interrogating your childhood or your memories of childhood, and you're not necessarily giving any advice, are you? You're just you're looking at these sort of classic relationships between sort of the primary caregiver and you as a child, and how that sort of played out as an adult. I mean, it'd be really interesting. Maybe we could talk just about kind of fictional case study, if you were okay with this. So let's just imagine, you know, a kind of typical male client coming to see you, who has, you know, an addiction problem. You know, maybe just talk us through about, you know, what are the sorts of things that present to you when you're dealing with this. Obviously, no, you know, we can't name anyone or anything like that. And how do you go about kind of treating someone like that?
Well, it really would be starting with the Human Givens acronym of RIGAR. I mean, I think that's a brilliant construct to work with. Because it does take all the component parts. You know, so I would build rapport with the client.
So just to explain for people who are not aware, and I'll put this in the blog below, RIGAR is R is rapport building, isn't it? I is information gathering, G is goal setting. What are the 2 A's? I should know this because I'm doing part 2, aren't I? But
it's funny because I always stumble on those 2 as well.
So sort of assessing, you know, where they're at and getting them to action, and then the last one of rigor is rehearsing success, isn't it? Which I think is good. So people talk through or do some kind of hypnosis really about, you know, imagining them doing the very thing they need to do.
Guided visualization, Francis.
Guided visualization. We don't call it hypnosis, no.
It's very interesting because Aaron Beck, who is the founding father of cognitive behavioral therapy, who worked with Albert Ellis, who founded rational emotive behavior therapy. I mean, you know, both rational emotive behavior and CBT have got tremendous merits to them. But Aaron Beck, or Tim Beck, as he's sort of, you know, familiarly known, easy for me to say, was at a university in America demonstrating the cognitive behavioral approach with a client who wanted to give up smoking and had some other bad habits that he wanted to get rid of. And unbeknownst to Tim Beck, or maybe beknownst to him, if there's such a word, was Michael Yapko, who was a young undergraduate at the time. Are you familiar with Michael Yapko? Have you heard of Michael Yapko? Actually, he's a clinical psychologist of many years standing, almost as old as I, might even be older than me. Goodness, makes me look like a youngster, which is wonderful. But he's very into hypnosis, and he's very into hypno-informed psychotherapy. But he is a qualified clinical psychologist, so he is a scientist, as it were. But he became terribly interested in hypnosis, and he was watching Aaron Beck go about working with this client in a demo. And he got the client to relax, settle into his chair, get comfortable, and focus on his breathing and just relax and notice the breath and allow his eyes to close down when he felt comfortable doing so. And then he invited him to kind of float back into a situation in which he'd been, where he was smoking or doing any of the behaviors that he struggled with, and to just observe himself doing them. And then he invited the client to drop into the body and to then share with that body that he dropped into the interventions they've been discussing in the previous session, to see how that went. And, you know, just talked him through that and stayed with him, and then kind of invited him to come back to the room and asked him how it went. And he said it was really good. And he did manage to stop his smoking in the subsequent sort of weeks and months that followed. And Yapko talked to him afterwards, you know, joined the queue, really, I suppose. And said to him, I didn't know you did hypnosis. And he said, I don't. And he said, well, what do you call that then? And he said, that was success imagery.
Right, success imagery,
So it's amazing how different schools and different prejudices creep in to the perception of the sort of acceptability or efficacy of different approaches. You know?
I mean, it is interesting, isn't it? So I was reading some early Freud writing, because, you know, he started in hypnosis too, because that was very popular, wasn't it, in the late 19th century as an approach. So I mean, maybe we can return back to this. Let's say a man, let's say possibly middle-aged man, let's say perhaps alcohol, you know, is a serious problem for them. Maybe we'd say, you know, they're fairly high functioning, you know, and I think the reason why I'm bringing this up, because I think possibly for both genders is a significant issue in our culture. We know statistically that a lot of people are kind of more or less alcohol dependent. You know, you do a bit of your rigor, you information gather, you build rapport, you kind of set some goals. What if they can't do them? Or, you know, how do you go about sort of dealing with the kind of more difficult issues if they're coming back and they're saying, well, I tried, you know, you've done a bit of hypnosis with me. I tried to set this goal of not drinking, but I have to have a drink, perhaps in the evening or quite a few, just to calm my nerves, that kind of thing. How do you deal with that?
Well, it really is about the rigor sticking to within it, because within that framework, you've got everything that you need, and you don't need to depart from that at all. But within that framework, there is infinite scope to go wherever you want to. Because I would start by building rapport, getting some information, getting to know who the person is. There is something that I tend to favor, which is asking them about their drinking career.
Right.
And that's quite an interesting kind of way to frame it, because it immediately pops up questions about drinking career. What do you mean? Well, when did you get promoted to 6 pints a night? Because you started off at 2, and yet through your sort of perseverance and determination and practice, through repetition, you became really quite good, and your toleration became higher. Of course, you don't need to say all of that. It's implicit in your drinking career, which kind of tends to lead to a little bit of a quizzical take, or not, if they've had therapy before and encountered that approach. And of course, that's all part of building rapport. And it does also allow for an introduction, or at least a sense of the acceptance of the validity and presence of humor in the therapeutic relationship. So we can laugh and we can sort of, my career, oh God, I got promoted to chief pisshead quite early. That sort of thing, which is fine. Because it also it identifies in a way the personality of the person sitting in front of you. And that's pretty important too. And that's where psychoanalysis can be so brilliant. Because I'm aware of, when we were on the Human Givens course, I can't remember his name, but if he should ever watch this, he'll know who he is. An Irish fellow whose partner was there as well.
Oh yeah. I can't remember his name.
But he was sort of telling me how dismissive and scathing Joe Griffin was about psychoanalysis. And how it was really not worth a jot and all that sort of thing. And I did wonder about that, because, obviously everyone is entitled to their opinion. And I'm not absolutely for a single second putting psychoanalysis up there, with the sort of sacred. I'm not doing that at all, because we all know of the people who left, because Alfred Adler, who had a clash with Freud and said, not for me, thanks. Fritz Perls with Gestalt, said, look, not for me, thank you very much. Eric Byrne, and the list goes on, of the people who obviously got to a point where they thought, no thanks, I don't want to belong to your cult. I think this is more than that. But nonetheless, without psychoanalysis, there wouldn't have been that branching off. It kind of reminds me of a quote from someone called Wallerstein, who talks about a movement that fails to outgrow its founding fathers is doomed. And I think that's a great quote, because you do need to, and we do. It's a great, it's a what, sorry?
Yeah, it's a great quote. And I guess, if we were coming back to this, say, sort of functioning male alcoholic, then, you're starting to go a bit deeper into, so, let's say, it feels to me, and Human Givens is really good at this, you have, as a therapist, a lot of very practical tools of what people can do. They can do a bit of hypnosis, they can do this, they can do that, but actually, without going into the core of what someone has, these primary relationships in their life, their relationship with their primary caregivers as children, and understanding how they built these patterns, isn't it? In Human Givens, they call it pattern matching, don't they? Where, if you've been brought up in a dysfunctional household, you will, more than likely pattern match in a dysfunctional way with many other people in your life as an adult, and unpicking that is quite important. I mean, Freud would call it projection, wouldn't he? And
well, actually, Freud would probably call it repetition compulsion.
Yeah, repetition compulsion. Yeah.
But projection comes into it, and I think this is the point, that there's lots of interlinking between the different kind of labels that are given, because there is, something called projection and projective identification. There's also transference. But that tends to be sort of more onto a person rather than into a person.
And so that happens perhaps in the therapy room, doesn't it? Classically.
It does. Yeah.
The therapist is, the client transfers onto them some sort of status that the therapist just doesn't have, based on their childhood. I mean, maybe, I like that. So really what we're talking about in sort of more colloquial terms is going much deeper, isn't it, into what's going on. You find that's necessary because that in a way is against some of the kind of ideas of CBT, for example, cognitive behavioral therapy, which is basically really about reordering your thoughts. So maybe just talk us through a little bit about your thinking around that and your experiences that you really do feel you have to talk to clients about what's happened to them as children.
Yes, well, actually, I don't need to talk to them about what happened to them as children. If they want to talk to me about it, that's okay. But I certainly wouldn't sort of look at that. And clients will actually say, what is this about? Do you have to go back into my childhood? That has been said to me before, because and that's a sense of kind of a defensive sort of buttress to put up there first. But that's sort of revealing something about the person sitting there, because there might be something about childhood that they're concerned will emerge. There might just be a sense of impish humor that they wish to. There may also be a narcissistic personality organization, which kind of says, of course, I don't need to be here, but I'm here because I love my wife and she said I must come. So I'm here just to prove that I don't need you. How's that? And so it's the sense of getting a sense of what is there in terms of it's as much about what's not said as what is said. And it's also, it's also very much about the idea, which tends to be quite central to psychoanalysis and the psychodynamic approach, that it's about putting language to feelings. I personally struggle a little bit with that. Because what that tends to kind of avoid and obviate is what I would refer to when in your original question, what do you do about going deep? Well, I go deep by not using deep technical terms. So I would refer to something as the felt sense. That for me is more than enough. That covers all bases. And it's also about what kind of feeling goes with that for you. And there's quite often, and Janina Fisher is somebody, I love her approach, and she's very, very well known, certainly in the States, but on the international training and lecture circuit as well. You've heard of Janina Fisher?
No, I haven't actually. Take me through Janina Fisher.
Okay, well, she deals a lot with trauma. She's written something called The Fragmented Selves of Trauma Survivors. And that kind of segues into the theory of the personality of fragmentation. And she works a lot with, injured self. She's quite into internal family systems, which is parts. Parts is really object relations. Going back to the psychoanalytical paradigm of object relations, out of which comes parts of us.
I mean, I think like Human Gibbons is very scathing about some of this stuff, isn't it? But I think actually, though, Human Gibbons for me sort of says the importance of storytelling, which I think, just to explain, my understanding of things like internal family therapy system, which is very popular at the moment, isn't it? Is the idea that you, with your therapist, work out, who are it's quite technical. So I did know at one point, but basically, what is the sort of injured childlike bit of you? What is the little Francis, the little Bradley? And you get the little Bradleys to speak to the big Bradley, in the therapy, and they try and understand each other. Whereas I think, like, Human Givens for me is much less rigid and more plausible, that if this is a story you want to tell about yourself, let the therapist help you tell this story so you can understand it. But it's not always a story that a client does want to say to themselves about. As you point out, not every client wants to talk about childhood. And my experience, I've had kind of years, which I've stopped now, of psychodynamic therapy, is that it was very helpful to go into my childhood at certain points. But then I could see, and I agree with the Human Givens critique, that you just land up re-traumatizing yourself if you're not careful, particularly if you've had a pretty difficult childhood. And there's so much understanding that can happen, but you're not, it's not a helpful process. And in the end, I didn't find it a helpful process. So I think that that has to be borne in mind. I mean, what are your thoughts on any of that?
Yeah, no, I'm completely in concurrence with you on that, Francis, because again, it's very much about being in the therapeutic dyad, and getting a sense of where the person's at in their life. And obviously this comes into information gathering. You would ask some explicit questions. How are you doing? How was your day? What's it been like for you? If it's a client who's returning, I would say, how has your week been? And we'd kind of start from there. It's a conversational type opening, but it's really, and I will at times say and again, one has to get the sense of, is this appropriate to the setting? Is this appropriate to the client as they are now? Does this fit the sense of the dynamic in the room at the moment? And often it's very helpful, therapeutically, to just sort of wonder with a client and just say, what happened just then? Where did you go? Because the client may sort of look away, and there's a moment of almost a trance-like absence,
daydreaming.
Well, there's a shift of state. So, a lot of this is about sort of, it's quite often called interstate travel, which is an obvious metaphor for being in the car and traveling. But often a person can absent themselves. Because as you mentioned a pattern match before, something can come up in the mind, in the body as well. And it is a felt sense. So, it's very much about, what went on for you then? Then the verbal, the logical left hemisphere sort of comes in with the with the verbalizing, and sometimes at the expense of the creative right. And although that is a metaphor, although literally we have a left and a right hemisphere of the brain, obviously we do, with a corpus callosum between the two, but that's what provides the interconnectivity. So, the logical left and the creative right, if we think of that as a metaphor, and this is also borne out, by the way, very interestingly, in Joseph Ledoux's book, Anxious. He writes about split brain patients. And this is a real medical situation in which people with really extreme epilepsy, who are in danger of dying through the epilepsy. It really was a fairly drastic kind of step to take, but it was decided that surgeons would, actually physically sever the links between the right and left hemisphere connecting to the corpus callosum. So they would literally be independent brains. So Lisa Feldman Barrett, an effective neuroscientist, is on record as saying, I hate it when people talk about two brains. There's not two brains, there's one. you know, and she's quite right, there is, because it is largely a metaphor. But in this case, it was literal. So the severing of the corpus callosum from those. And this resulted in experimentations whereby the split brain patient was shown the image of an apple to the right eye. And it's important that it's to the right eye because that connects with the left hemisphere.
Yeah.
And then they were asked, what did you see? And they couldn't answer the question.
Right.
And then they were shown an apple to the left eye.
Yeah.
Which connects to the right hemisphere.
Yeah.
And then they were given a bag to put their hand in. And they came out with the shape of an apple. So we can sort of see how the different parts of the brain organize slightly differently. Therefore, that kind of segue was about the verbalization of experience, which can only go so far. It goes a long way, and it's hugely important. But it is the not only but also phenomenon again. It's not only the verbalization of what's happened, it's the emotional, sentient feeling state.
Yeah.
What does it feel like when you tell me that?
Yeah.
What do you notice in your body? What images come up for you, if any? So it's kind of like that VACOG acronym, you know, the visual, auditory, kinesthetic, olfactory, and gustatory. And just to make it easy, think about your face, eyes, nose, mouth, skin, ears. So I would do that with a client rather than VACOG, because they'd sit and look at me and go, what the fuck is VACOG? You know, or if they're not quite so coarse, they say, do you mind telling me what that means? And I don't mind which, because again, you meet the client where they are.
Yeah. So what we're talking about is people, you know, and again, the Human Givens does a lot of it, you know, really in the therapeutic space, talking in a safe environment about very difficult experiences, maybe the times when they're feeling extremely anxious, or the times when they want to drink, and then they are sort of almost the therapist, your strategy is to get them to sort of drop into their body and to really feel that experience, the smell it, touch it, almost taste it, and understand sort of what's going on in their body. So it's, for me, that would be, because my big thing is mindfulness, that would be quite mindful, a kind of approach, almost doing a sort of body scan when you're talking about particular issues, and accepting, you know, how you're feeling, and understanding, you know, what your body's doing in that moment. Yeah,
absolutely. And that's very much the mind-body connection.
Yeah.
So, I mean, what I would tend to favor is the pendulation.
Yeah.
So it would be about the pendulation between, and I often use this explicitly, but not all the time. I mean, I've got the flip chart behind me, and that's sort of got various different things on there that sometimes I never point to because it's just not necessary. It doesn't come up. And other times it's really necessary.
Yeah.
You know, I had a couple in here recently where I had to stand up and show them the Gestalt cycle of experience.
Yeah.
And just sort of, you know, look at that kind of cycle, because we all have rhythms. We all have moments where we go through the day. We wake up. It gets towards midday. We feel hungry, so we eat. And then it goes into afternoon, and then it goes into evening, and then it goes into late, and then we sleep. And so we're through the cycle. So we all have these circadian rhythm type experiences, you know, and we also have the different rates of speed of the brain itself, you know, where you go through that sort of, you know, beta, alpha, theta, delta brainwave, and then fast asleep. So we all go into the hypnagogic and hypnopompic state twice a day, you know, in the morning and at night, or depends what time we go to bed, of course.
I mean, we've just got a few minutes left, but you know, it's a very rich experience stuff, and I will write an accompanying blog from this and sort of dig out your references, and hopefully for the, you know, the listeners and the readers to look at it, which is a very it's one of the reasons why I asked you on here. There's a very kind of rich and open-ended sort of, I would call smorgasbord, isn't it, of different kind of modalities of therapy that you're interested in. You know, what would be your sort of advice to someone who perhaps is thinking about taking up therapy? You know, where apart from your good self, of course, if they're not near you in Brighton, obviously you are available online, I think, aren't you, as well, so they could get in touch with you. But you know, what would you say to that person who's sort of considering taking up, you know, concerned about something and considering getting some therapy?
Well, I'd say to them, shop around. I'd say to them, don't be shy about interrogating the therapist, finding out what their modality is, what their paradigm is, what they were trained in, what their qualifications are. But more importantly, to set up whatever free consultation that they are offering. I will offer a client a 15-minute free phone call in which they can talk to me about anything they'd like to ask me. I can't do more than that. I used to offer a free session in the early days when I was establishing myself, and that will still be available. So I would say to people, shop around and don't be afraid of asking for what you need. I need you to tell me how you work and what your likely rate of success would be to get some real concrete feedback. That's what I would suggest, because a good therapist will be fine with that. You know, someone who's experienced and genuine in what they do will be able to tell you, I can't give you any guarantees. I can't tell you it will take this long. What I can tell you is that on average, it would take between 6 and 12 sessions to establish an end. But in some cases, clients have come to me and within 2 or 3 sessions have said, do you know, I'm where I need to be. Now, that's either a flight to health, because they're bailing out because you're getting too close to stuff that's too difficult, in which case the time isn't right for them. And it really is about sort of meeting a client where they are. And it's not unusual for me to see a client returning after a few years. And we re-engage again, and we just touch on where they were, where they are now, whether they've kind of regressed back or whether they've moved forward. And so it really is about the rigor, sort of rapport, information gathering. And it's accessing internal resources was the first A. And the second one is setting goals, you know, which you've done in the sort of prior to that. But then the other one is accessing resources available to them in the outside world. So you're looking at the internal and the external world, and it's always about where those meet. You know, because we have internal ideas, what Lisa Feldman Barron would call predictions. The brain is a prediction making machine. So, you know, we get that cue, we get the expectation arising in us with the outcome that then suggests. And we kind of get caught up in that. So a lot of it is about being able to kind of either step outside of ourselves and sort of observe ourselves from a distance, you know, that sort of observing self idea of Arthur Dykman, or just using that relaxation guided visual imagery to get a sense of calm that allows the mind to clear. And then the solution, which has been right in front of you all along, becomes apparent. So, you know, it really is, as you said before, a smorgasbord. But, you know, with experience, one gets the sense of which way we need to be going and which way we are going. And it really is following the client. But at times, and this is where the person-centered approach for me, you know, kind of falls down. Sometimes you need to guide the client back onto the path that they've already told you they wish to be pursuing. But that in pure person-centered terms would be directive. And yet there's a wonderful quote about the person-centered in a book called Beyond Carl Rogers, written by a fellow called Charles Brazier. And in that book, he says, you know, what Rogers said was that we should find our own way. And so if we did what Rogers said, then we're not doing what he said because we're not finding our own way.
Yeah.
So which I think is rather good, because it really is about the kind of almost laissez-faire, the client will find the way, but you need to be there alongside them. But that's sometimes taken too literally, as meaning you can never therefore lead the way. No, you can't do that. But just by being in the room, you're already leading the client to a collaborative venture. So there's always going to be that power imbalance in the therapy room, and there's nothing you can do about that existential fact except to accept it. And a lot of good therapy is about acceptance. Because, whenever someone comes to me with an addiction issue, it is meeting a need in them. The problem is that it's meeting the need in the short term. And it's what one calls negative reinforcement. When you're drinking or taking drugs, it takes away, as in the negative subtraction sign, it takes away the pain. So everything's great so long as you're drinking. As soon as you stop, the pain returns. So that's where the dysfunctionality of the solution comes in. But every addiction is an attempt at a solution. It's an attempt to meet an unmet need. So it's being able to guide the client in understanding their own process.
And well, thank you. That's a really nice way to end this, because it sort of comes circular back to what we first started talking about, really, around addiction. Thank you so much, Bradley, for this. And I will leave at the bottom of the blog, your website and details for contacting you if anyone's interested in taking up any kind of therapy with you, and we'll certainly carry on, hopefully, this conversation at another date as well. So
I'd be delighted. I'd be delighted to do exactly that, Francis. And if ever you're down this way, drop in and have a cup of coffee, sir.
And I will certainly do so.